Hi, my name is Sophie and I had surgery at the IWK. Lots of kids come to the IWK to have surgery, a procedure, or a test. Surgery is when a doctor fixes something inside of your body. Well, you have a special sleep with medicine. Are you going to have surgery too? Come with me and I'll show you all of the places you'll see and people you will meet. Here are some tips that I found helpful when I had my surgery. Some kids come to the IWK a few days before their surgery to have a pre-op appointment. This means that you get to learn all about your surgery and meet the healthcare team that will be taking care of you that day. Tip 1. Remember to ask all of the questions you've been thinking about at your pre-op appointment. The night before my surgery, I had a shower and a snack. You can't eat or drink too close to your surgery. Your parents will know what time you have to stop eating and drinking. Tip 2. Remember to pack your favorite toy or stuffy. You can even take this item to the operating room with you. When I arrived at the IWK, we followed the green wave painted on the wall to the elevators. We took the elevator up to the 3rd floor to the day surgery area. We had a seat while my mom filled out the questionnaire. The nurse called my name and we walked over to the desk. This is where I had a quick checkup. The nurse checked my weight and height, my temperature, my blood pressure, and listened to my heart. She asked if I had any allergies. If you have an allergy, the nurse will give you a red bracelet to wear. Next, I got my very own room. This is where I waited with my mom and got ready for my surgery. I got a bracelet with my name on it. The lady from registration even gave my stuffy a bracelet. Next, I met a nurse that gave me a pair of hospital pajamas to wear. Sometimes kids have to take medicine before their surgery. The nurse gave me some tips to make this easier. I also met a child life specialist. She helped me get ready for my surgery by talking about all the different things I would see and be doing. She even showed me some pictures so I knew what to expect. I also learned things I could do if I started feeling nervous. Tip 3. Don't forget to ask for an activity. There's lots of fun things to do while you're waiting. I got to meet my doctor. She talked to my mom and me about my surgery and asked if I had any questions. Next, I met my anesthesiologist. Can you say that word? He talked to me about the special medicine that would help my body have a sleep during surgery. He told me that the medicine comes through a mask or an IV. When it was time to have my surgery, I walked with the operating room nurse to the big doors, where I hugged my mom and said, "See you soon." On the way to the operating room, the nurse pointed out all of the pretty pictures on the wall. Tip 4. See if you can find the flying pig on the wall on your way to the operating room. My job in the operating room was to climb up on the bed and lay down. I got to pick a show to watch on the TV and I held my stuffy close. The doctors and nurses in the operating room wear scrubs and hats. This is to make sure the room stays nice and clean. There's 2 ways an anesthesiologist can give you the sleep medicine. One way is to use a mask. The medicine will come through the mask like air and your job is to take big breaths. The second way is with an IV that goes in your hand. An IV is like a tiny straw. The IV helps your body to get the sleep medicine. Before I knew it, I was asleep. My mom waited for me in the waiting room. A liaison nurse made sure to give my mom updates while I was having my surgery. When my surgery was finished, I woke up in the wake-up room. First I saw my nurse and she told me my surgery was over. She asked how I was feeling and I made sure to tell her. I still felt a bit sleepy, but that was okay because I was still in the special hospital bed. The nurse called my mom to come see me after I woke up. I got to have a popsicle, but the nurse will tell you when you can have a popsicle. If you are going home after your surgery, you get to take a ride in a wheelchair. Don't worry, if you have to stay overnight, your parents can stay with you and there's lots of activities to keep you busy. Tip 5. Make sure you pick out a finger puppet to take home with you. I hope this will help you feel more prepared for your surgery.